As the state moves to reopening the economy, many small businesses will need help with measures to protect the health of customers and employees. Some of that help is being provided through a collaboration between Tufts Health Plan and Lawyers for Civil Rights through its BizGrow program. To tell us how it works from Lawyers for Civil Rights is the program's director, Priya Lane. Thank you very much for being with us, Priya.
Thank you for having me, Chris.
Priya, one of the things that people might have overlooked before the pandemic here is the BizGrow program, because an important part of what you do at Lawyers for Civil Rights is actually help with business growth. So explain, how does that work usually?
Yeah, so we believe that building wealth in minority communities and helping communities of color is an integral part of the civil rights movement. So at BizGrow, we help minority, immigrant, and women-owned small businesses through the life of their business with free legal support, business support, and anything they need to really bridge that opportunity gap that they have.
Well, I think the last time you and I talked, there was an opportunity gap in terms of public contract opportunities for these businesses. What's happening with the pandemic now as far as the gap in opportunity?
We're seeing that a lot of small businesses, minority, immigrant, women-owned small businesses, are seeing a huge gap because they started behind. And so with this pandemic and everything that's going on, they have further to catch up. In reopening specifically, we have seen a scramble to get the PPE and other supplies that they need in order to reopen.
Well, I imagine one of the other problems here is that there's an information gap because we're all learning so many things now that we didn't know a couple of months ago. So what about helping businesses figure out what they have to have?
Yeah, so we're working with small businesses every day, working with both the state and local authorities to really figure out this guidance and make sure that small businesses, minority, immigrant, women-owned small businesses are able to meet the need, reopen as quickly as possible so they can start bringing in that money that they need to stay alive.
What are you hearing from some of these businesses?
It's hard. It's hard for everybody, and it's really hard to figure out where to need to source PPE, to buy PPE, to find the funds to get their employees back. And so anything that we can do to help, we're trying to get in there and make sure that they're at a level playing field to make sure that they can reopen and compete for the business that's out there.
Well, the program that you're working on right now with help from Tufts Health Plan is the businesses can receive up to $1,000, at least $1,000 worth of aid of some kind. What could that mean exactly?
Yeah, so thank you to Tufts Health Plan for really having the foresight here to see that minority, women-owned small businesses are really going to need this extra support to purchase PPE, to, for example, a salon might need it to put plexiglass up. And where do you buy plexiglass? How do you buy plexiglass? How much does that cost, right? And this is all stuff that small businesses have not had to think about probably before. And so, and they haven't set aside the funds, especially in this pandemic for it. And so trying to get them what they need, cleaning supplies, face masks, whatever they need to meet compliance, make sure they're safe, their customers are safe, and that they can safely reopen.
Well, there are many small businesses. I can think of small stores where people need to buy food. They can be pretty cramped. Can you help somebody with that issue?
Well, so, obviously all of the businesses have to follow the guidance laid out by the state, and we're trying to make sure that they can, as much as humanly possible, open. And so looking at their space, reconfiguring their space, putting up shields, putting up, sneeze guards like you see at Chipotle or whatever, all of those things can help a small space open, but obviously it costs money. And so that small gap can be the reason that they don't reopen, because they don't have the money to buy the gear necessary that a smaller space would probably need more.
Of course, what you're also working on with these businesses is legal advocacy. What kind of legal issues do you see for businesses now that they might not have had to think about very much before?
A lot of the issues we're seeing are lease related. Obviously, small businesses have not been able to be in the space as and using the space in the same way, and they haven't had the money coming in to pay their landlord. And so even though there is a moratorium on commercial evictions, a lot of landlords are still moving forward or threatening. And so that simple sort of lease negotiation where the small business owner doesn't necessarily feel like they're at a place at the same field as their landlord and can negotiate. So working with them on those tools has been a big part of the work we've been doing.
Over the years, you've also worked with businesses who have to deal with immigration law compliance. Has that changed in any way during the pandemic or going into the future?
I think that's always an issue for small businesses, especially in our minority and immigrant communities, making sure that they are in compliance with the law, but that they can still hire who they want to hire and protect themselves, their employees, and their business to make sure it's an asset for them. And so that continues to be an issue that we are working with them and making sure that they feel comfortable, secure, and safe in their small business.
Just coming back to the rationale for the program here, one of them, of course, is about public health. You have a health insurance plan essentially funding this, and philanthropic motives aside, I guess there's a good public health reason to be doing this too, right?
Yeah, so Tufts Health Plan, with amazing foresight, approached us saying, we know that you guys work with minority, immigrant, and women-owned small businesses and know how what they need right now and have access to them. And so they have partnered with us to really make sure that wellness, health, and safely reopening is a priority here. And so making sure the small business is safe, making sure the customers are safe, and using this money for good and to make sure that these businesses can safely reopen.
Because one of the other things I'm thinking of with this program like this, you might have a business that knows very little about what needs to be done and how to make it happen. I guess even just having a conversation with somebody in your program, that must be a pretty good help, isn't it?
Yeah, I hope so. We work every day with small businesses. It's totally free. They can contact us at any point to talk over issues they might have, legal issues with reopening. And if we're not the place, we can definitely connect them with resources that they need to make sure that they're doing what they need to do safely and that they're working towards reopening safely and bringing in that money that they need.
And either directly from your organization or from some of the other places, there are ways of helping in different languages too, right?
Yes, yeah, we speak multiple languages at LCR, and we are happy to make sure that translation services are available if we don't speak the language here.
One other thing here, because $1,000 worth of aid doesn't sound that big, but just to get a business started so they can start generating income, what do you see, at least as the best possible scenario from that?
So a lot of these small businesses have figured out, they've gotten SBA loans, they figured out how to, kind of operate where they are, and then they were ready to open the doors. But what they didn't budget for, none of us could have imagined budgeting for, is the money needed to retrofit your small business to meet new compliance guidelines for COVID. And so that money is very often just the gap between getting customers in the door and bringing in more money. And so Tufts Health Plan, had the foresight to think of that and the leadership to think, okay, well, let's get that money out there and make sure that these businesses are opening as well as businesses that had more revenue to begin with.
Well, of course, we're also here to spread the word. So if businesses are interested in getting some of this help, what's the next thing they should be doing as far as getting in touch?
So unfortunately, we had over 800 applicants and we had to applications close yesterday, but we're hoping that we can continue and get more funding from this and continue to give out this support. And so please contact us at BizGrow at lawyersforcivilrights.org. And we're happy to talk to you about your small business and connect you with anything that you might need to help you with your reopening.